it's Dr. Amanda with StraightSmile Solutions, StraightSmileSolutions.com, and today we're going to talk a little bit more about uprighting molars with braces or Invisalign. Is it okay to leave it like that? Should you always upright it? And I get this a lot when I work with my doctors at StraightSmile Solutions, and we'll get a case that clearly has a tipped molar, kind of like this. And patient is coming in and chief complaint is my front teeth, I want them straight. And I don't want to deal with my back teeth, I don't care. And a lot of times doctors feel like they're stuck in the middle because they know it's the right thing to do it. Maybe they don't know how to do it. Maybe if they wanted to do it, they'd have to refer it out to an orthodontist. So they're kind of stuck as to what they should say. Should they, kick the hornet's nest and bring this up, or should they not? So this is what I always tell them. I tell them, in order to do orthodontics, you need to know risks, benefits, and alternatives. Alternatives means all the different options. So even if the patient's coming in asking for only front teeth straight and they have an issue in the back, you still need to advise them what it would take to fix everything, all the alternatives, even if that's not with you. So you need to, if you don't feel comfortable working that ClinCheck up to ideal, to show them how to do everything and what it would look like and how many aligners it would take and what the cost might be if it's different, then you should tell the patient, hey, I'm a general dentist. I really only work with front teeth, if that's what you do. A lot of general dentists do everything, with ortho. It would probably be best for you to have these molars uprighted. But if you're looking for that, I will need to refer you to an orthodontist down the street in order to do that. But I strongly encourage you to get that information, because I want you to understand what your options are, and I don't feel like I can adequately explain that. So that would be one way you could say it. If you do feel comfortable doing the ClinCheck, or if you want help doing the ClinCheck, even if you're not even going to want to provide that service, you're welcome to work with us at StraightSmile Solutions. We can help you optimize that ClinCheck so you can present that case to the patient, show them what the option might look like so you can qualify that referral to the orthodontist a little bit more, even if you don't want to do it in your office. At least you can show them what it would look like. Of course, that's not going to be a light case or a moderate. It's not going to be an express case. It is going to be a comprehensive case, and it might take 30, 40, 50 aligners to be predictable. But I really think you should show them what it looks like. And plus, it's a great exercise for you to learn to use how to use the software and how to move teeth. You can learn a lot, right? And explain the risks of leaving it to the patient. And they can always go to the orthodontist if they want to get it done. If you want to try it, it's not that hard, but it's all about case selection. And you really need to keep in mind where the wisdom teeth are too, because sometimes you cannot lift a tooth like this, unless you take the wisdom tooth out first. And it's not always possible to mesialize this either, depending on the bite. So each situation is slightly different and you need to evaluate it. So in essence, what I'm saying is you can't just omit that part of the conversation. It is a part of the alternatives. If you were to only present the part that the patient's asking for and not the alternatives, you would be doing the patient a disservice, and that would be considered below standard of care. And if and when later, if you didn't document that conversation in writing, and for me, I actually write it out. Here's the options, A, B, and C. If I'm only offering some in my office, I'll say what I'll offer. Here's the risks if you don't fix this. Here's the risks if you don't fix that. So let's talk about the risks. If you do not upright a molar and you just leave it as is, what's going to happen? Well, that tooth will eventually collapse. Over time, it might be a couple of years, it might be a decade. But in time, that tooth will collapse. They'll start to get periodontal defects like what's going on here, infections, etc. Other teeth above it can extrude or super erupt. They'll start to come out of their socket. So essentially, this patient will not only be losing this tooth, but they'll also be losing this tooth, and they'll be losing a lot of back teeth. So it is really important that you do get those teeth uprighted. Now, from a liability perspective, I know I'm speaking both to consumers and to doctors when I make these videos. So from a liability perspective, if that doctor did not present you that option and pushed you just through the anterior movement, even if that's what you were asking for, if they did not present it, document it, put it in writing, theoretically, there would be a liability for that doctor, because later, if you did have this collapse, you could come back and be like, whoa, you didn't tell me about that. I was never explained to me. It can get complicated. And I don't want to push consumers to be litigious by any means, but I really want to push doctors to practice to their standard of care, even if they're not offering all those opportunities, and to make sure you refer when you need to refer, and don't always just placate a patient with what they're asking for, because they may not understand the importance of uprighting a molar. And that they might be like, oh, I've been like this for years and it's totally fine. Well, they may not realize things can get worse. And it's your job as the doctor to make sure the patient fully understands their risks, benefits, and alternatives. And if that's not something you're educated enough to do in terms of the specialty, then you need to qualify that referral. Strongly encourage them to go elsewhere. And if you couldn't explain it, I would not start the anterior alignment only case until the patient had the information. That would be what I consider below standard of care. All right, thanks so much.